Hello, Nick from NK Active here. We are on our A to Z journey. We are on P. P is for Peroneal Tendinopathy. Run out of space. Or, if you're over the other side of the pond, you may call it fibularis tendinopathy. But we're going to stick with peroneals because I'm English. So, what are we going to do? First, we'll go through what are the peroneals. The peroneals sit on the outside of your leg and the outside of the foot. You have 3 peroneals, 2 true peroneals, possibly 1 imposter. So you've got one that's a peroneus longus. It's the longest one, hence the name. So it starts from head of the fibula, comes down the outside of the leg, it goes around the ankle, and then actually goes underneath the foot and attaches to the base of the first metatarsal. You then got brevis, which is shorter, halfway down the fibula, comes down round the outside and attaches to this little bony lumpy bit on the outside of your foot. A quick side note, the amount of patients we see who come in worried that they got a bony bit on the outside of the foot, don't worry, everyone has, it's normal, don't panic. And that's called a styloid process. You then have the rogue peroneal muscle, peroneus tertius, that comes down along the front of the ankle. I call it rogue because the others go behind, this one goes down the front. So, also, we can now show you what they look like. Bit of a warning, this is going to be a picture of the human anatomy. So, here we have 5 and 6, you got your peroneus longus, and then you got your peroneus brevis. So this is a human foot that's been dissected that we can then start looking at where these tendons are. You can also get a really good appreciation of how complex and how fun actually the foot is, but I may be biased because I treat feet for a living. So, how does a peroneal tendinopathy come about? Well, like with any tendinopathy, whether it's Achilles or peroneals, it's because there has normally been an overuse to it. If we think about it, tendinopathies either become overuse injuries, or there's a systemic problem, an inflammatory problem. So you may have like rheumatoid arthritis. If you've got things like rheumatoid arthritis, that's when you get true Achilles tendinitis, which is a large inflammatory problem. The majority of people we see is more peroneal tendinopathy, which is more you've overloaded the tendon and you've basically made it work too hard and it's not a happy bunny. So how does it present? So what you'll tend to do is when you get up in the morning, it'll be stiff, it'll be really uncomfortable, you'll be hobbling around like you're about 40 years older than you actually are. You walk around for a bit, things get easier, and then you then go do a bit of exercise and things flare up. Again, it will be described as sort of an achy type pain and it will really just start getting a little annoying. You'll tend to find anything where you put the load on the, trap my leg, on the outside of the leg, so anything rolling the foot outwards or twisting the foot outwards, that could be walking on uneven ground, will irritate things. Sorry, I just dropped my leg on the desk. And then you'll find that anything where you're rolling the foot in may make life a little bit more comfortable for you. So, what do you have to do? Firstly, we got to take, with any tendinopathy, you've got to take the load away to let things recover. But that doesn't mean complete rest. Complete rest is just as bad as doing too much. So you still need to do things, but you just need to get it to a happy place. So you can offload it by using insoles or sticking a wedge on the inside of the shoe, or we're now to a point where 3D printing insoles where you actually have, you can print the outside slightly stiffer and the inside slightly more flexible. You do that by, what you're looking at here is the infill pattern. You basically make the infill percentage higher on this side so it's stiffer, less on the inside so the inside is more flexible, just to try and take the load off the outside of the leg. We also find that some people after like an ankle sprain can develop these sort of things, or if you have chronic ankle sprains and chronic ankle instability, you can get these issues as well. Also on that, we see a lot of people in clinic who've had chronic ankle sprains over the years and they've had an MRI scan and like, oh my God, I've got a tear or a split in my peroneal tendon. Doesn't actually really matter. I am going to show you why. This bit wasn't planned, so I'm going to grab a random bit of paper that I haven't got Let me grab a post-it note. So you get what you call longitudinal splits in the tendon. So that means, say if this is your whole tendon, it's a tear going lengthways down the tendon. So if you get a bit of paper and pull that, it's a longitudinal split. It doesn't actually lose much of its strength or integrity. You're fine. If you get the transverse ones, different story. And the majority of them are longitudinal. So if you have a longitudinal tear, don't panic, it's okay. The word tear has scared you, but it doesn't matter. You're going to be fine. You just rehab it and strengthen it like you would do any other peroneal problem. You then need to start working on building the strength. So you can start doing exercises with exercise bands, build the strength up around the leg and the calf muscle region, and then start adding some weights. And then once you've done that, if you want to get back to things like running, football, tennis, you need to do some like hopping and jumping around. Think of it when you're managing a tendon problem, you need to build a strength. Think of it like building a house. Strength are your foundations. That's what you need. You can build a house without foundations, but the chances are you may get subsidence later on. So you want to build your strength, the baseline strength. Then what you then want to do is do your fixture and fittings, which is then from a tendon perspective, getting it used to then doing things quickly again. So if we think about it, a tendon needs to be nice and strong and its muscle needs to be strong, but you also it needs to be able to use quickly. So you build a strength and then you then do high velocity jumping, high speed movements to get it used to then doing the sport and exercise that you want to do. And then you then got to do your maintenance stuff. So just keep that strength up a few times a week to help reduce the risk of it coming back. So there we have it. Peroneal tendinopathy.